To say a little bit more about side effects from checkpoint inhibitors, if we're thinking about pembrolizumab, for example, for the adjuvant treatment of stage 2 melanoma, the way I try to explain to patients is that in principle, with a drug like this, there's a risk of the immune system, if you like, attacking normal parts of the body, which is what can cause the side effects. And I say that in principle, you can get inflammation in pretty much any part of the body as a consequence of these drugs. I sometimes use the example of the skin causing rash, the colon causing colitis or diarrhea, the liver causing hepatitis or transaminitis. And I normally say to patients in that situation that if that happens, typically they don't notice anything, but we pick it up on blood tests. I talk about endocrine side effects on the thyroid, on the pancreas, on the pituitary gland in the brain. And I also discuss the rarer but potentially more serious side effects. So pneumonitis, inflammation in the lungs, myocarditis, inflammation in the heart, and neurological side effects, so side effects affecting the brain and the nerves. I think in principle, it can be quite a daunting list for patients to try to understand, but I always say to patients that actually the important thing is most people do not have severe side effects, that the side effects are treatable if we pick them up early. And I think critically, if the patient gets in touch with us, with the team, if they're worried about side effects, it almost always makes them much easier to deal with.